This one's going to be a surgical tooth extraction that we did. Before we get into the footage, here's an x-ray that we took. This is a patient that came in extreme pain that we were fortunate enough to be able to see the same day. So here's an x-ray of the area that was painful, and we can see here that there's a very large cavity into the nerve on the first molar under this crown here. And when we take an x-ray of the roots, we can also see that there's a broken root tip that is going to need to be extracted. But the molar tooth, you can see that there's a little bit of infectious activity around that tooth as well. So it was actually the molar that was responsible for the pain. And we talked about options. We would have happily saved the tooth with a root canal, but the patient decided that they just wanted to have the tooth removed. So that's what we did. So after we give a nerve block, we're going to go in with a periosteal and separate the gum tissue around the retained root and just give it a little bit of elevation, and it mostly comes out on its own pretty easily for us. It was actually getting blocked by the molar, so decided that we would remove the molar and then the root tip would come out easily for us. So we're just going to separate the gum tissue a little bit around the first molar, and then we're going to put some cow horn forceps into the furcation, and then this is sped up, but we'll usually spend a good amount of time kind of just wiggling the tooth, trying to get it out in one piece. Here the tooth comes out, but we had a root fracture there. You can see that the root has broken off, so we're going to go in back and retrieve our retained root first here, which comes out easy, and then we're going to grab the mesial root of the molar tooth, and it just fairly loose, so it comes out easily for us. And then this molar tooth actually had an accessory root that had a deep fracture around it. So here you can see the root is just kind of sitting in the socket, and it needs to come out, otherwise it's a source of infection. It's a tough situation. I actually tried to retrieve it with an endo file, so sometimes I'll just drill a little pothole with a really small round carbide burr and then try to engage it with a SX endo file. And we engage it, we get pretty good engagement, but there's too much friction, so it doesn't want to come out of the socket, even though it's just kind of dangling in there loosely. And this technique does work. Here's another case. Here's another case that I did where we just use an SX file to engage the root canal, and then it just pulls right out. So it does work, but it didn't work in this case. So the next best option is to remove a little bit of bone to make a purchase point to just spoon the retained root tip out. So we're just gonna go in with a fissure burr and remove some interseptal bone, give us some space to just pry out the root. Patient doesn't feel any of this, by the way, they're totally frozen. And then we're gonna curette the socket of infectious tissue before giving a sterile saline irrigation. And then site's pretty much good to go. We're going to put in a little bit of gel foam into each socket, which just helps with hemostasis. Then we're going to give post-op instructions. I'll usually give 1,000 milligrams of Tylenol, 600 milligrams of Advil before sending the patient home, have them bite down on some gauze, and that's going to heal up just fine.